Good afternoon, everybody. I'm lucky because I'm one of the last speakers in the last group, and you just had coffee, so you are awake. You are ready for a story of until dinner, until the mastika, to hear from me about our profession. But first of all, I would like to to thank the Pan-Atlantic Pharmaceutical Association to be here, to enjoy your hospitality. And one of the things I happened to drink was mastika. And I don't know whether you know what mastika is. Mastika is a drink. It's from a juice from a tree from the island Chios. And Chios, yes. And what this drink, they told me, is without alcohol. But as you know, I'm a pharmacist, so I read the bottle. It states 30%. So I had, up till now, I enjoyed the hospitality. I had a wonderful time. I had the privilege and the honor to meet the president of Greece, which was a very nice visit. Kostas and I had the chance to discuss with him the situation of the Greek pharmacists. Of course, we talked about the refugees, the immigrants, the great problems. I said to the president that we will, as PGEU, make clear to our members that our Greek colleagues need help and assistance in coping with this problem, and he was very pleased with that. And as you heard from Jurate, this president is also very much pharmacist-minded, and I was, of course, very pleased with that. As you see, I am a pharmacist, and I think it's important to state that I'm very proud to be a pharmacist. I'm proud of what we as a group, as a profession, have achieved in healthcare up till now. And I think that's very important. I have traveled all over Europe. I have traveled and seen and spoken pharmacists in all EU countries. And what is so striking about that is that I always have the feeling that we speak the same language. There is no difference. Why is this important to make this remark? Because I've also been the president of the Royal Dutch Pharmacists Association, and then you are in the position to also speak to the highest people who own the chains. And they speak another language, and that's essential. If you speak to a pharmacist, you're feeling that he is busy with the patient, giving him the best care. And of course, he wants to earn an income with that. But in that direction. So first patient care, and then the result is the income. How different is it if you speak with somebody who owns a chain? He thinks in financial terms. That's a totally different way of looking at a pharmacy. And the result is, I can tell you, last week I spoke to a pharmacist who is working for a chain, and he said, I resigned. I resigned. Do you know why I resigned? Because I don't get the facilities to do my work properly. I have not enough people around me and the time to do it properly. This is a big difference, and I think our policymakers should be aware of that. So maybe now you understand why I'm engaged to promote our profession, and I will talk with you. I have here the summary. It's only 12 pages, as Tony saw, to talk with you about the vision of PGEU on the pharmacy profession. This this vision is written down in 2012 under the presidency of Mrs. Isabel Adeno, and it's written down what we think is important for our profession. We are busy with safe and accessibility to medicines. We are trying to improve the outcome of the therapy. We are trying to improve the public health, and we are trying to improve the system efficiency. This is what we would like. And this is happening all over Europe. This is our vision. But this vision is also our competitive edge in healthcare. If everybody is aware of this position, they will see it's important, and that it's not finance first, but outcome and patients are first. So there is a lot of power in this. So it's a limited view if somebody is only busy with the costs. It's a limited view. It's very important. So I would like to talk with you about our profession and the way we think as a PGEU, how it's going to change, and what are the prerequisites of change. We are doing this all over Europe. You've seen this picture before, because I borrowed it from PGEU. It doesn't mean that in every country that everybody is in the same phase. France may be in a different phase as Germany, and Germany may be in a different phase of Czechoslovakia. But it doesn't matter. If we are all going for the same horizon, the same result, that's what counts. So this is what we like to achieve. I will not talk about PGEU because otherwise I would double too much. I would like to talk with you about the implications of this change, of this gradual change of the pharmacist profession. The first one and most important one for having a pharmacy is the remuneration of the pharmacist. There is this tendency to go from margins to more an emphasis on fees. Is that logical? Is that good for you? Yes, it's good for you. It's logical because prices are going down, so the margin, the absolute margin, is also going down. But the amount of work is still staying the same. So it's logical that you are paid for the amount of work in terms of a fee. It's logical. So this tendency you will see all over. France, for example, is making the turnover from a total margin system to a combined system of margin and fees. Several countries already made this move. The second implication is in the education. The changing role will have impact on the pharmaceutical curriculum, and I will give you later an example. And it will require continuous professional development. If you state that you are the medicines expert, you really should be. You should be educated, you should really know it. The third implication is sharing tasks. Collaborative care. Doctors and pharmacists are, in our view, part of the same team treating the same patient. It will be an active role in primary care, and the pharmacy is the most accessible facility in this. So the doctor can't do it alone and the pharmacist can't do it alone, but together they are very strong in their performance. And the fourth implication is the access to patient health records and privacy issues, things like that. Advanced IT systems will roll over Europe to get this realized. I will give you an example. But as stated earlier, this continuous budgetary pressure will stay. Due to aging and other factors in Europe, there will be a continuous budgetary pressure on healthcare budgets in Europe. And the added value of pharmacists and the financial advantages of medicines management is insufficiently clear for policymakers. So there is a role for you, locally, in the nations, but also for PGEU. And it is to be expected the financial pressure on pharmacists and medicines and the pricing level will continue. Price cuts, reduction of margins, co-payments are easy tools. Liberalization is a fashionable word, but I sometimes wonder whether politicians really have thought about whether liberalization is so good for healthcare, whether it's so good for general things. So, a lot of discussion possible. So in this environment, it's a fundamental challenge to maintain our vision and extend our professional mission and our relevance for the health systems. Oh, there was one behind. Sorry. It's a fundamental challenge, and we should stick to the vision and stick to the roadmap we are designing. Key is expertise. Why is expertise key? You can't copy it. We all have an academic education. We have expertise, we have knowledge, we try to maintain the knowledge. There is no chain, nobody from outside who can copy this. This is your unique selling point. Use it. If you have this expertise and you maintain this expertise, you only can do that if you have data. It's essential. And if you have these data, you can prove that the outcome, that the outcome will be better. So if you move over from the old way, from dispensing to the outcome of therapy, you are giving added value to the healthcare system and to the society. Collaborative care, adherence, clinical values are keywords in this respect. And the question up till now is that maybe the people who are watching on internet to me and are thinking, yes, a nice story, but I am in deep troubles. So this is not going to happen. How am I going to face the future? What argument do you have that this will be true? I think I will give you one argument, and it's the next slide, and it comes from IMS. In 2012, I was involved in a minister summit in Amsterdam, and as a preparation for this minister summit, IMS provided a report as a preparation. And this report was called Advancing the Responsible Use of Medicines, and that as a result of this changing role I discussed about of the pharmacist, substantial costs in healthcare can be avoided. Worldwide, $500 billion of avoidable costs. For example, in the Netherlands, because you can, of course this is worldwide, but you also can specify it per country, but I know it for the Netherlands. In the Netherlands, the amount of avoidable cost is almost as big as the total pharmaceutical budget. So we spend 5 billion euro of pharmaceutical care in the Netherlands, and the avoidable cost is 4 billion avoidable costs. That's so substantial. It's an estimate. I know. It's substantial. It's real money. It's enough. It's showing that if the pharmacist can do his work properly, it will pay out. So I would say I don't talk about costs of pharmacy. No, I see them as an investment. And why is it coming back? Because people, if you are treated well, you don't have to go to hospital. Think of somebody who has COPD and is not taking his inhaler properly. What happens? He gets an exacerbation, has to be brought to hospital, all kinds of costs, unnecessary if he was treated well. If you have diabetes, you don't do it right, you know the consequences in diabetes care, big consequences, you will go to hospital. All avoidable costs, substantial avoidable cost, which can be avoided if the pharmacist can do his job properly. So he has to have enough room to do it. So how do I see then the role of the pharmacist? I see two things. There is core business, and core business is everything around the expertise of medicines. And here are the examples: dispensing, compounding, emergency care, medication management, medicines review, treatment of minor ailments. This is all around expertise. And if you look at all those activities, I hope you agree with me, they will take time and they need to be rewarded. It's all possible to give a fee for each item. And it's already done. It's already happening here in Europe. Nothing new. This is the new way for the income of the pharmacist. That's why I say from margin to fees. The second group of activities I see as more as like services. Measurement of blood pressure, cholesterol, weight, vaccination, providing pregnancy tests, smoking cessation, and yes, we had the discussion, are we going to ask money for that? Do we need a fee? Do we need a fee, or is it service? Is it providing the competitive edge for a pharmacy? Up to you. But it's possible. And it's already happening. It's nothing new. It's reality. So, from this respect, and here I stated the vision of PGEU, is that in order to embrace current and future challenges, we want to create a future where services offered at the European community pharmacies at the heart of the communities by highly qualified and independent health professionals, community pharmacists, further support individual patients, public health and the healthcare system. It's possible. Education. Is it already a reality that it's changing? Yes, I know there is also already a European law coming ahead, but yes, there are already universities who are changing their curriculum. I was involved in setting up the new curriculum of the University of Utrecht. And what they are doing, in essence, is that they will, as I was educated in more like chemistry and analysis and things like that, and pharmaceutical care was far away. But now, in the new curriculum, they want patient care in the curriculum. It's a word which I use precisely in the curriculum. So I think, Patricia, in our European attempts, this should be one. I said, if you have expertise, you need data. But do we have the data? If patients go from one pharmacy to the other, you don't know what they are taking, what kind of medicines are taking. I think in France they took a very intelligent solution. It's called the dossier pharmaceutique. You give every citizen a card, and with the card the patient can give access to an internet system and all the data are there. Then you have the overview. Then you can use your professional expertise to see whether it's right or whether it's wrong. So in summary, so it's pretty short in the end. In summary, the remuneration of the pharmacist, we will make the step from margins to more an emphasis on fees. In education, curricula will be changed and we will be educated continuously. We will share tasks with doctors and we'll try to have the access of all the files available of this one important patient. Thank you very much.